half of my employees have health care through the store, and so I'm responsible for basically the health care benefits of my employees. And it affects me every year in increased premium and decreased coverage. And it affects me both because I pay for health care for myself, and I'm also responsible for making decisions for the health care of my employees.
It is very important for us when you say to listen to that farmer that Tom mentioned in Iowa, to listen to the folks that we get letters from.
Hi.
And I have employees that need health care from, in their 20s all the way up to their 70s. And so we run the wide range and how it affects everybody different. We've got people with families and we have single people, and so it's frustrating. It's probably one of the biggest headaches that I have. It really comes down to the cost versus benefit. How much are we willing to pay versus how big of a deductible are we going to get versus, what's your total out of pocket, what's the coverage and all that stuff.
I have great concerns that people around this table are not listening to the American people and are fearful of the consequences of this large bill, which is why only 1 in 3 people of America support what is being proposed here. And that's why so many people, Mr. President, are saying it's time to start over.
And the flaw is their ratings are based on segregating people because of their health.
And so I really just want to see something that gives better coverage for everybody at a more reasonable price.
Do the lawmakers have the answer to that question?
I am not sure who has the answer to that question, but it sure seems to me like if anybody should know the answer, it should be them.